Okay, we are live. So today is July 10th and the time is 10:02 and I am calling the Greater Boroughs Partnership for Health meeting to order. My name is Isabella and I'm the chair of the advisory board. So just the remote opening statement. This open meeting of the Greater Boroughs Partnership for Health Advisory Board is being conducted remotely consistent with Chapter 2 of the Acts of 2025 relative to extending certain COVID-19 measures adopted during the state of emergency. This act allows the advisory board to meet remotely so long as reasonable public access is afforded so that the public can follow along throughout the meeting. Members of the public who wish to view the live stream of the recording may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. And lastly, ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. So with that, I will just confirm members. So when I call your name, please respond in the affirmative. Taylor from Southborough
Present.
and Anne Marie from Boylston.
Present.
All right, and then Isabella from Northborough, I am also here. And then we also have Michaela, our staff, our shared service coordinator and regional epidemiologist. So with that, I think we are ready to go. Michaela, if you want to share your screen.
Yes, let me get it up. You see that?
Yes, perfect.
Beautiful. Okay, so jump right in. This is the agenda that was sent out beforehand. We'll do kind of a shared service update, and then we'll talk about the nursing software. I have a maternal and child health data presentation. Then we'll approve meeting minutes and talk about the next meeting date. So first on the agenda is, I don't know if I can hide this. Yeah, there we go. The part-time public health nursing position. We have the job description. It's relatively similar to the original job description, just adjusted for part-time. And so I want to talk about posting it, initial screening, and kind of the interview process and who wants to be on the committee. And then just kind of making a note as part of our work plan throughout this process, we'll be developing a kind of noting how we do this and go about it so that we have a template for the next time we go to hire. But yeah, open it up to kind of talk about posting and who wants to be on the committee.
So the job description was approved by our personnel board last year, and it is a grade 5 position. So the hourly rate is $38 to $49 and some change. So that is what it will be posted as. And then we had said through our budget conversations, it would be a 16-hour position. Again, some wiggle room depending on where the salary lies.
I'm happy to do it as I did it last time.
So last year it was me, Taylor, our assistant town administrator, Diane, and then I think that may have been it.
Yeah.
So we can do that again if that works. I don't know if there's any discussion or changes. Amory, does that sound okay with you?
Yeah, that's fine with me. I trust you ladies' judgment.
Perfect. And I know the interview questions that we had are from some other shared service arrangements. So I think they were pretty good questions and we can continue using those as well.
I think, sorry, did you say where you posted it or no?
We haven't posted the position yet.
Okay.
Yeah, why don't we talk about that as you guys are the nurses, so you are the experts. Where do you suggest us posting the job?
So I think we should still post it with the state. I think we should post it in the same places that we did last time,
Okay.
which was through the state, MHOA, right?
Yep.
MAPHN, which now with the new website, you can just do it yourself.
Hmm.
Um, did you put it on MMA?
I don't think we did this position, no.
I still don't feel super strongly that you need to.
Okay.
The only other place that I was curious just to gain more traction is if we should put it on Indeed.
Okay. I can talk to our administration to see like what that process looks like.
Yeah, because we didn't get a lot of traction. And I feel like those places, like, you kind of have to know about them.
Mm-hmm.
So just to get more interest.
And then Michaela, you can also maybe reach out to Tamara from the state to see if she has
Mhm.
any other suggestions. I'm sure there's, some other SSAs that are hiring as well.
Yeah.
Yeah, perfect. Well, we'll start there and then we will be more creative. I know with some of the other job descriptions, we reached out to local colleges. I know this position is a little unique, but we can see if there are ways to kind of strategize it. And then once we do hire this position, the state is really ramping up their nursing training. So that will be great timing for them to do tier 1, tier 2, tier
Yeah.
3 trainings
But
with this.
maybe like a master's level,
Mhm.
someone, because there's specifically Worcester has like a master's in public health nursing program.
Okay, that sounds good.
Perfect.
Okay.
Yeah, and at the bottom is kind of a rough timeline, obviously tentative on application process and kind of
Yeah.
scheduling availability.
Fingers
I
crossed.
yes, this is very much the blue sky plan.
Yeah,
We'll see if that happens. Okay, so we'll
That
get
sounds
to
good. So we'll probably post the job description at the end of the month. We're just waiting for final approvals from OLRH on our budget.
great.
yes, yeah, they're finishing the review process ideally July 14th, so that
Okay,
should be kind of
perfect.
the final date. We'll post it after that. Beautiful. So next, speaking of nursing, updating on current nursing services. This is kind of a similar update to a couple of months ago, just now looking from January to June. There's been 15 blood pressure clinics, 12 home visits, 3 different education events, 2 vaccine clinics, and then 1 home vaccine. And then for Maven cases, kind of looking at this a different way, but wanted to show like the volume of reports that come through Maven versus kind of like how many we actually investigate. Most of these are still flu and COVID since this is January through June, but starting to get some more tick-borne cases. And then as of July officially, Penny and I have taken over Maven coverage for Westboro. So previously it was more of like an as needed basis, but now Jim has stepped down from that role, so it's Penny and I covering Westboro's Maven. Um, Other things that have kind of been added is the senior center hours in Westboro, Tuesdays from 9 to 1. Penny started that last week. We'll be continuing to do that once again now that Jim has stepped down. And then Penny has also been working on some hands-only CPR trainings. She hosted one in Northborough a little while back and is kind of continuing getting some traction for that. And then one just temporary update. Celeste is out for July through August. So Penny will be covering the senior center in Northborough for those weeks and switching her days from typically she's in on Thursday, but she'll be in on Wednesday now. And then kind of looking forward, we're working on scheduling and coordinating for fall vaccine clinics and getting dates for those. We'll probably be more um, reaching out a little bit more during August to really nail down some dates for those. And then Penny's also working on setting up some blood pressure clinics in Westboro at Beach Street. So this is kind of the broad overview. A lot's been happening. But before I move on to talking about inspections, are there any questions or any notes on the nursing services?
No, thanks for putting that together.
Yeah, no problem. Yeah, this has been a work in progress and hope to kind of like we talked about with the SOPs, keep doing stuff like this. So in a similar vein, looking at inspections, again, this is from January to June. Um, just the number of inspections. Now we're passing over the number of permits because we're getting into kind of that second inspection during the year. So looking at the number of inspections by town, still mostly restaurants and retails and mostly routine inspections. There are a couple different complaints in June and May, but nothing too crazy, pretty standard. And again, new addition, we're adding Westboro food inspections on more of a regular basis. It had been kind of per diem as needed in February, but now we've set up to do roughly like 8 to 10 inspections in Westboro a week, depending on kind of what they need. Ray's still doing inspections, but helping cover there, so that will probably increase. And then we've started working with MHOA on youth compliance checks for tobacco in Northborough and Boylston. So once again, a lot going on, but this is kind of just the overview of where we're at. And if there's any questions or comments, happy to take them before moving on. Okay. Next, another busy slide. But this is just kind of for your awareness of what I will be working on and probably reaching out to you to work on from now until October, which is the first term of our fiscal year. A lot of this is stuff that we've actually already kind of started on. What's outlined here is things that we'll get to kind of check off today in terms of creating regular reports of shared services that are being delivered. Um, Already working on that SOP and the hiring process for the nurse. And then in a little bit, I'll be presenting on some maternal and child health data to get us started on how we want to shape that throughout the rest of the year. One thing to kind of note in September is the FPHS will probably come back up at our board meeting. We'll review that again. And then I'm hoping by that point as well, we'll have some of these SOPs created for review and kind of talk about getting those solidified. And then finally, this last one that's highlighted for today is translating educational materials, which we have a good update on that I'll talk about next. But before I move on, I know this is a busy slide, you'll get this. But if there's any questions or comments kind of about July through October before moving on. Okay, so on to some more exciting news. Um, In terms of communications, we were able in the end of our last fiscal year to translate and print the food resource guide and the maternal child health guide. We also added these postcards with QR codes to the online version in all of the different languages. So we printed a bunch of those so people have access to it even after we go through our printed materials. But we were able to print several in English, Portuguese, Spanish, Arabic, and Haitian Creole. Um, so I probably will be coordinating or popping by in the next couple weeks to drop off these printed materials so that you guys can hand them out at fairs or just have them in your office for anyone that stops by and might benefit from the resources in these guides. Um, so exciting update. And yeah, any questions or comments about this as well?
No, I just wanted to say great work. This has been both of these resource guides actually started out as intern projects, so it's really phenomenal to see like how they can, evolve and change and actually become this, amazing resource. So thank you, Michaela, for tidying these up and working with the translation MAPA, correct?
Yes.
Who have been very great to work with, and now we have all of these resources in 5 different languages. So thank you.
Yeah, absolutely. I'm happy to work on it. This is exciting for me too, making these accessible. And I will say, like, moving forward, working with Mappa was a great experience. So anything we want to have translated, they're great to work with. Okay, and for our favorite discussion, nursing software, we kind of brought this up last meeting and decided to wait and talk about it now. This is just a refresh of kind of the highlight pros and cons of both, the relative cost. This was FY25 estimates, so it might be slightly more expensive now on either end. So I want to get people's thoughts on where we're at, if there's a leaning towards one or the other, or kind of the decision process on this. So open it up to comments or questions.
I know we've had a hard time deciding. Michaela and I did try to have someone from a town that has used actually my senior center and my Juna to come to the meeting today, but they were unable. So we can, decide to vote now with what we know. I know a couple of us have done demos, or if we want to wait until we are closer to hiring a nurse, have them, the individual from Hudson come to our next meeting to talk about the differences. We're more than happy to do either one.
I think that's a great idea, Isabella.
The latter, having them come to the meeting.
Exactly.
Okay.
Yeah, I think I'm in favor of waiting to hear what they have to say as well.
All right. So we will invite them to our next meeting once we find the date and time. And then I will also get FY26 costs so we can have accurate numbers. And I think we'll go from there. And then hopefully we'll have the part-time nurse as well so we can do training all together.
Yeah. That sounds good.
All right.
Saving that for later. Okay, so now I'm going to walk through some maternal and child health data that I've been putting together. This was a work plan objective from last year as well, and we're carrying it forward this year. So kind of to get things started, I wanted to look at an overview of our population, what are some common health trends that we're seeing, and just kind of start asking some questions about what we might want to work on or continue working on this next year. So get started looking at birth rates, demographics, kind of access to care in our area, and then health outcomes and risk factors. So to start, thinking about how many births occur in our region every year. So across the 4 towns, there's a wide range from an average of about 40 births per year to 215. In those bottom bar charts, you can see kind of just the raw numbers. And then on the top is those numbers adjusted for the population size. Obviously, Westboro is much larger than Boylston or Southborough. So when you look at this as a rate per 1,000, overall it's relatively similar and for the most part steady over time. Boylston has actually kind of increased and then plateaued a little bit in the last few years. Northborough and Southborough kind of bounce around, relatively steady, and then Westborough is slightly decreasing and then plateauing over the last few years. So kind of just thinking about the number of births, but then also how it's trending over time, which is relatively stable. Then thinking about in our region, who those expected parents are. One thing that is kind of relatively different from the state average is our age of people giving birth. It's mostly 30 to 39, whereas the state average is a little bit more evenly distributed between 25 and 39. So an older demographic, which also kind of pairs with the fact that 80% of parents have a bachelor's degree or higher. Across the state, that's closer to 50%. So Massachusetts is already a very educated state compared to national standards, but our region, our parents are even more educated. And then our race breakdown, majority of parents are white, with the next largest proportion of demographic being Asian Pacific Islander, which is a little different than kind of what we see across the state. And then third being Hispanic populations. Most people have English as their primary language, again, slightly higher than what we see at the state level, with Spanish and Portuguese being the next languages spoken by parents. So then thinking about some of the risk factors during pregnancy, for the most part, smoking is a very low percent of expecting parents, which is good to see. As far as alcohol use, it's like 1% higher than the state. So 4% of expecting parents did use alcohol during pregnancy, but 96% still did not use any alcohol during pregnancy. And then for gestational diabetes, a slightly higher rate than we see at the state level. 9% of breathing people had gestational diabetes compared to 7% at the state level. And then as far as BMI prior to becoming pregnant, it was lower than the state, so only 25% of people were categorized as overweight, and 15% were obese before they became pregnant. So then kind of looking at some other outcomes and health concerns more related to pregnancy. One concern that is not necessarily unique to Massachusetts over the past several years is maternal mortality. In general has been increasing, but that impact has not been felt equally across racial and ethnic groups. So in 2018, Black pregnancy and postpartum people were 2.6 times as likely to have severe maternal morbidity than white pregnant and postpartum people. Additionally, Hispanic individuals were 1.5 times as likely to have severe maternal morbidity. So this is at the state level. I don't necessarily have local level data, but given that we do have a Hispanic population in our region, this is definitely something to kind of think about and maybe something to look into. As far as causes of maternal mortality, there's not necessarily super local data again, but at a national level, roughly 20% of that is typically hemorrhage. 16% is infection or sepsis. The infection or sepsis has been changing over time. During COVID, that was much higher, but it's kind of been falling back behind some of the other conditions over time. And then looking at STI rates, this is at the local level. Across the board, our region reports lower rates of all STIs, chlamydia, primary and secondary syphilis, gonorrhea, and HIV. Chlamydia is the most commonly reported STI, whereas syphilis is kind of the least common. But this is a good trend to see. We're low. Massachusetts is also low compared to the national average of STIs. So that's looking at STI rates. For infant mortality, this is also lower than the national average and roughly on par with the state average of 4 deaths per 1,000 births. Obviously, you want it to be as low as possible, but encouraging to see that, we're not exorbitantly higher than other places. kind of flowing off of infant mortality, low birth weight, again, similar trend in that we're on par with the state average of 7.6 births were considered low birth weight, whereas the national average is 8.4%. And for this, low birth weight is considered anything less than 5 pounds and 8 ounces. So then kind of thinking about how people in our area have access to care. Um, this is a rough map. This is still kind of an evolving data collection process. It might be something to continue to work on, but at first pass, these are the 4 hospitals that have a birthing unit within roughly a 10-mile radius of our region. Obviously, our towns are not in a perfect circle, so this is kind of a rough estimate of the center. But there are 4 hospitals. We've been continuing to kind of refine this list and add and take away from it. And this isn't the only place that people go for labor and delivery. There are other hospitals like in Boston, but this is kind of just a rough map. And thinking about how prenatal care is paid for or covered across the state, roughly 40% of pregnant people are under public insurance. In our region, it's much lower at like 15% on public insurance. And in our region, 8% of pregnant people are enrolled in WIC during pregnancy. That's not necessarily all encompassing of everyone who's eligible to enroll is enrolled, but this is the number of people who are actively enrolled. So this is a lot of data, and I kind of want to end with stepping back and reminding that this is more of a starting point to think about who we're serving, what their background is, what trends we are currently seeing, and kind of want to open it up to talk about what of this piques your interest or what of this is something we want to dig into as we go out throughout the rest of this year. So with that, I'll open it up for comments, questions. Also happy to go back to any slides if people want more time to digest the information.
Two things kind of stuck out to me. One, like maybe just a deeper dive into access to resources, obviously, is an important one where we can connect people with resources that they may not know about.
Mhm.
The other one that I kind of found interesting is the map of birthing hospitals. Metro West recently was in the news. They're having a hearing to possibly shut down their labor and delivery unit because of severe lack of staffing. I don't know what ended up happening there because I never followed up, but it would be worth looking into. And then just kind of evaluating maybe like local offices and seeing where those people go to deliver would be worthwhile too. That way we can have more local data on where people are actually going throughout their pregnancy versus like, excuse me, the hospital.
Yeah, I think that's great, especially like kind of the qualitative. I know Isabella sent me a chart from Northborough the other day that was of like where people actually gave birth based on town records.
Mhm.
So I think to that point of they're not just going to those 4 hospitals.
And
So
that would be
good to know.
interesting too. Like if we could do a deeper dive on that, like are they going to
Mhm.
local hospitals or are they going somewhere else?
Yeah.
Yeah, I would definitely recommend working with your town clerk because they have that data. I think I was surprised that there was, I can't remember the exact number, but a fair amount of people also going into Boston.
Yeah.
Yeah.
But I love that. I think access to resources is where we could improve on from our foundational public health services, kind of that whole assessment. So I would love to work on that as well and just understand like how can we meet the people where they're at and what
Exactly.
resources do they not know of or do we need to make that connection? So I think our resource
Or
guide
do we not?
is
And
right. But I think the resource guide is like one step of creating all of the resources in
Yeah.
one document, translating it, but how do we get it to those places? Can we
Mhm.
partner with OBGYNs and, get that information into like the waiting rooms and things.
Exactly.
Yeah. No, I love that. I think kind of focusing on that access and pairing some of this with more like qualitative type of information would be really helpful. Awesome. Anything else we want to discuss before I move on to back to admin and meeting minutes? Okay. If this works, I might have to escape. I tried a new presentation format, so bear with me. Get this in. So now back to meetings. We have some upcoming trainings. I'll send out the actual links and times for these. Most of them are in the afternoon between like noon and 1 on these days, and they're all virtual. But flowing off of the presentation, FPHS showcase on maternal and child health, where they'll be talking about kind of bridging that gap in local public health. Clinical liability for local public health, hoping that maybe is a step in answering some of our questions that we've had as a group. So wanted to highlight that training. And then MHOA Lunch and Learn Stories from the Field. So this is 3 different local public health professionals kind of providing their experience and how they've navigated through different challenges in their role. I want to highlight those.
The
You said you were
first,
gonna send the links out for those?
Yes, I'll send the links and the information. I think we might still be waiting on one for the clinical
Okay, that's the one
liability.
that I was like, oh, I didn't see that one, so.
Yeah. I think I have to dig through my email in one of the newsletters, but I don't know if they have a link. And if
Okay,
they don't have it by the time I send the email, I'll make sure to follow up so
okay,
everyone has it.
thanks.
and the first 2 are free, and then the third one, if you're an MHOA member, it's free. If not, I believe it's $25. So if you need PHE funds for that, just let Michaela or I know. And going off of that, we're in FY26. Yay! So if you have membership dues that need to be renewed and you want to request PHE funds to do so, just let Michaela and I know, and we will get that squared away.
New year. Okay. Last one, approval of meeting minutes. These were sent out with the reminder from June 9th and then our additional meeting on June 23rd.
I thought they looked fine, so make a motion to approve the meeting minutes from 6:29 and 6:23 as written.
Seconded. All those in favor, Southborough?
Taylor, yes.
Boylston?
Anne Marie, yes.
And Northborough, Isabella, yes. Perfect. So those are approved and we will get those posted on our website today.
Yep. And then next meeting dates. So back to our regular meeting schedule with September 18th. And want to check on the time because we had originally moved this to 10 a.m. Because we like the morning time. Does that still work on the 18th for everyone?
I have it in my calendar as the 11th.
I do too.
Okay.
I think
And
it's
that
the
day
second Thursday.
is a hard day that I had mentioned briefly about maybe changing the date because that's usually the day of the MAPHN meetings.
And also
Okay.
it's the MIHA conference in Plymouth, the
Okay.
week of the 8th, the 12th.
All right. And Thursdays work best for everyone?
It depends on the day, but I mean, in general, yeah, Thursdays are fine.
All right. I can't do the 18th at 10. Could anyone do the 4th at 10?
Right now, my schedule is clear.
Yes.
Emery, does that work for you?
Yeah, that works for me. The 4th, September 4th.
Yes, at 10.
Uh-huh.
All right, perfect. So Michaela, just send that out in your email and we can confirm with Jen and Maria as well.
Okay, perfect. And we'll keep the 10 a.m. time. Correct. Okay,
All
and
right.
then the 13th as well. I may
The
I may
13th
have
is
this.
correct.
Okay.
13th, it just says 1:30 on my calendar though.
Okay.
Yeah, so is that, I can't remember from the last meeting. I think we wanted to change them to 10 a.m., but was there uncertainty about the November date?
There was because of MHOA, but it's the week before.
Right.
Okay.
So November 13th at 10 a.m. works?
Yeah.
All right, perfect.
And
Works for
again,
me.
that's that day that MAPHN has a meeting, but there's going to be new leadership, so I'm not sure. So I would say, yeah, that's fine for now.
Okay, we'll revisit that in September as well.
Yeah.
Okay.
Perfect. That's all I have. So if there's anything else before we adjourn, any other thoughts?
No, I guess next steps, we will wait to receive approval from OLRH for our budget, and then we will start posting the job description. It will be posted as like a 2-year position, because the grant right now, we only have the contract through FY27. So we will post that, and then for the nursing software, I will get updated numbers and we will ask, Hudson or if another town has used both, to kind of do a small presentation at our next meeting. And I think that's it. All right. Someone want to adjourn?
Sorry, make a motion to adjourn the meeting at 10:39.
I will second that. And then all those in favor, Southborough, Taylor,
Yes.
Anne Marie Boylston,
Yes.
and Isabella Northborough, yes. It was very nice to see you. I hope you enjoy the rain, as it cools down, but reach out if you need anything, if you need any invoices, and we will see you in September.